Okay, time to dive in, everybody.
Right.
Today, we're tackling adrenal glands, hormones, all that good stuff.
Mm-hmm.
Specifically, though,
Right.
we're looking at Addison's disease
Yeah.
and Cushing's syndrome.
Yes.
Sent over some mid-school notes, and
Okay.
looks like we've got some pretty cool mnemonics to help us through this.
Mnemonics are always good, but I
Right.
think we can go a little beyond those too
Absolutely, yeah.
and really get into the nitty-gritty of what these conditions do
Yeah, what they do to your body.
to the body. Exactly.
So first up, Addison's disease.
Okay.
Now, the notes say it's all about absent steroids.
Uh-huh.
What does that actually, mean for someone who's dealing with this?
Well, it means that their adrenal glands aren't making enough cortisol and aldosterone.
Okay.
And those are really important for your blood pressure, how much energy you have, how you deal with stress.
That makes sense.
Love that.
Because the notes, they mention, low blood pressure, fatigue,
Yeah.
but then there's this bronze pigmentation thing.
Right.
That doesn't seem like an obvious symptom for a hormone problem.
Yeah, it's kind of a classic sign, though,
If it's-
of Addison's. And basically what happens is when the cortisol is low,
Okay.
it triggers this feedback loop, and it makes more of another hormone called ACTH.
Uh-huh.
And that can actually increase your melanin production.
Oh,
So
interesting.
that's what causes that darker skin.
So it's not a tan?
Out of suntan.
It's like
Hormonal.
hormonal.
Yeah.
Interesting.
Yeah.
Notes also mention something called an Addisonian crisis,
Yes.
which sounds like a little scary.
Yeah, it can be.
What's that?
That's when your cortisol levels get dangerously low.
Oh.
And you get really bad low blood pressure, maybe confusion. You could even pass out.
Wow.
So it's definitely an emergency situation.
And the notes say no steroids is death,
Yeah.
which is pretty intense.
I mean, it gets the point across, right?
It does, yeah.
Yeah.
This is serious stuff.
It is very serious.
So let's talk about what actually causes Addison's.
Okay.
The mnemonic here is ADD,
Right.
autoimmune diseases, damage.
Exactly.
Can you break those down a little bit for us?
Yeah. So most of the time,
Right.
it's caused by autoimmune disorders
Uh-huh.
where your own immune system attacks the adrenal glands.
Oh, wow.
Yeah. And then other things can be infections.
Like what?
Like tuberculosis, tumors, even if your adrenal glands get damaged from surgery or a bad injury.
Wow.
Yeah.
So we've covered the absent steroids of Addison's.
Right.
Now let's go to the other side of the coin,
Okay.
Cushing syndrome.
Yes.
Or, as the notes put it, cushion of steroids.
The cushion, too much. Right.
Too much.
Yeah.
So with Cushing's, it's too much cortisol instead of not enough.
Exactly. Opposite problem.
Opposite problem.
Yeah.
And we got another mnemonic for the symptoms here.
Okay.
High GH, big, round, hairy.
High GH, big, round, and hairy.
So starting with high H,
Okay.
what does high blood pressure mean for someone with Cushing's?
Well, high blood pressure puts a lot of stress on your heart and your blood vessels.
Oh,
So that increases your risk for heart attack, stroke,
a lot.
all those cardiovascular problems.
So that's a big deal.
It's a major concern, yeah.
Okay, the notes also mention weight gain
Right.
and a kind of round appearance.
Yes.
Is that connected to this extra cortisol?
It is, yeah.
Okay.
Cortisol kind of controls where your body stores fat.
Yeah.
And with Cushing's, you tend to gain weight around your belly, your face, upper back.
Uh-huh.
And that's what gives you that what we call truncal obesity, that round look.
And then there's the descriptions of moon face and buffalo hump.
Right.
I mean, those are pretty vivid.
Yeah, they are, but they're also pretty common with Cushing's, yeah.
Wow.
Because the extra cortisol causes fat to build up in those areas.
Oh.
So, yeah, it makes your face rounder, and it creates that fatty hump on the back of your neck.
And we can't forget the hairy part of the mnemonic.
Right.
What's up with that?
Well, some of the hormones that are higher in Cushing's, like androgens,
Okay.
they can make your hair grow more, and that can lead to hirsutism.
Hirsutism?
Yeah, that's just the medical term for too much hair growth, especially in women.
Oh,
Okay.
okay. So to recap, the cushion of steroids in Cushing's
Uh-huh.
can be caused by a few different things.
Yeah.
The notes mention steroids again.
Right, but this time it's the medications.
The medications.
Yeah.
Not the stuff your body's making.
Right, exactly. So if you take steroid medications like prednisone for a long time, that's actually the most common cause of Cushing's.
Really?
Yeah.
Wow, but then there's also tumors
Right.
in the pituitary or adrenal glands.
Yeah, because those are the ones that control your cortisol.
Right.
So if they have a tumor,
Okay.
It can mess things up.
And even some types of lung cancer can cause this.
Yeah, they can actually make hormones that, like, act like cortisol.
Yeah. So there's a note here about not suddenly stopping your steroid medications,
Yes.
even if you think you might have Cushing's.
Very important, yeah.
Why?
Because you got to work with your doctor to, like, slowly wean off them if you need to.
Oh.
If you stop suddenly, it can shock your body
Oh, no.
and throw you into that adrenal crisis.
Like with Addison's.
Exactly.
Wow. So we've gone through the key stuff for both Addison's and Cushing's.
Mm-hmm.
And it seems like the biggest difference is too little cortisol versus too much.
Yeah, that's the main thing.
But is there anything else that can help us keep them straight?
Well, it's always good to, like, compare specific symptoms.
Okay.
So, like, blood pressure, for example.
Okay.
Addison's, low blood pressure. Cushing's, high blood pressure.
Oh, that's easy.
Yeah, pretty clear.
What about weight?
With Addison's, you're usually losing weight. Your muscles are wasting.
Okay.
But Cushing's, you're gaining weight, especially that belly fat.
And their effect on skin is different too, right?
Totally different.
How so?
Addison's, remember that bronze pigmentation?
Uh-huh.
Cushing's, your skin gets thin, bruises easily. You might even see stretch marks, those purple striae.
Okay.
Yeah.
And hair?
Addison's, you might lose some hair. Cushing's, you get hirsutism, all that extra hair.
And then lastly, electrolytes.
Yeah.
Because I see something here about potassium.
That's another big one.
No.
Addison's usually causes high potassium.
Okay.
Cushing's, low potassium.
Wow.
Yeah, they're opposites in a lot of ways.
So many differences. But it's helpful to lay it all out like this.
I think so.
So now, what about treatments?
Okay.
What can people do about these conditions?
Well, for Addison's, the main thing is hormone replacement therapy.
Okay.
So basically, you take medication to replace the cortisol and aldosterone you're missing, and you usually got to do that for life.
Okay.
But it works really well. People can live totally normal lives on it.
That's good.
Yeah.
What about Cushing's?
So that one depends more on what's causing it. Oh.
So if it's the steroids you're taking,
Yeah.
then you got to carefully stop taking those, slowly wean off.
Okay.
But if it's a tumor,
Yeah.
then you probably need surgery to remove it.
Makes sense.
And then maybe medication to get your hormones back in balance.
Wow. So it sounds like both conditions need, like, a doctor's care
Definitely.
and careful management.
Absolutely.
Well, this has been a really awesome deep dive.
Yeah, I think.
We went way beyond just the mnemonics.
Right.
We really got into how these things work,
Yeah.
what they do to your body,
The mechanisms.
and how important those little adrenal glands are.
They're tiny but mighty.
Tiny but mighty.
Yeah.
Exactly. And, the mnemonics are great.
They're good for remembering.
good for remembering,
Yeah.
but it's really that deeper understanding
Right.
that can help you, recognize these things and get help.
Exactly.
So I'm curious now, thinking about all these symptoms we've talked about.
Are there any that you're going to start noticing in yourself or other people?
Baby. Yeah.
It's amazing how just knowing a little bit
Right.
can make you so much more aware
Totally.
and maybe help you get the care you need.
Or help someone else get it.
Yeah,
Hopefully.
exactly. So until next time,
See you then.
keep on learning, everybody.
Bye.